First Nations Health Authority is proud to be a partner with the communities of BC. Our goal is to deliver culturally safe services and to have our teams located closer to community.
The FNHA capital program includes 5 different types of investments at this time. The first is for mental health and wellness facilities, which include treatment centers. We also have health facilities, which include health centers, nursing stations, and visiting professional residences. The First Nations Primary Healthcare Initiative sites are also included in the program. We have health emergency infrastructure investments. And finally, it's also FNHA staff accommodations, including the Metro Vancouver Office Project.
With most of our communities, they're rural and remote, and so they need a lot of support in getting access to services. So with our capital projects, we're making sure that the communities have the facilities that they need to deliver services in their community, and some of the communities need higher level care, such as our nursing stations that FNHA does provide support to. We need to have housing and residences for the people that are coming into work so that they have a place to stay. So the capital team has been really helpful with the northern region and doing an assessment on the communities so that the people we bring into the community have a place to stay, they feel safe, and they feel comfortable. When we talk about cultural safety and humility, the communities know how to make these centers fit their community, their protocols, their traditions, and that all comes into play in that health center.
So capital has always been a huge need in the interior region. We've been able to add additional nursing residents, and the impact to that in our communities has been culturally safe services run by community for community. We also have had an amazing initiative by 15 communities, the Tekal-Dene, the Chilcotin, and the Schwetmik in the Williams Lake area. I never thought I would see the day of this happening. A primary care clinic with a GP and NP, mental wellness. Those are just a few things that we have going in our region.
So we have 3 large projects that involve capital, 2 treatment centers and a primary care center. Road conditions can be very tough when you have a lot of rain, not just snow. So we do have a tendency to get regular mudslides on the number 1, the main highway that goes to Hope and then feeds into a lot of our communities in the Fraser Canyon. So it can cut them off and also cut off services going up that way on a regular basis. It takes a long time to get any services there generally because it is quite far away from the hub services. So having something closer to home built on the Coast Salish culture is going to be really important.
Another key aspect of ensuring access to culturally safe healthcare is to bring health services closer to home, something we talk about in the regions a lot. And the way in which we can do that is not only to support the programs and services that our health directors and community leadership implement, but also to build the infrastructure so that there are clean, safe places to bring specialized healthcare services closer to home. Possibly bring dentists into community, bring optometry into community, bring services that people are looking to access closer to them so that the access is more seamless.
Emergency evacuation infrastructure, like helicopter landing pads, creates a lot of opportunity, not only for health evacuations. It creates opportunities for mass evacuations if there are any climate challenges or emergency evacuations at a community level. And opportunities and partnerships like Helicopters Without Borders is just one way where FNHA can advance those goals. For our past 10 years, we've worked through a series of activities that have culminated in what we call the Metro Vancouver Office Project that sees FNHA building a primary administration office on Tsleil-Waututh Nation land. The need and interest was to bring the teams together in a purpose-built space.
This will lead to better teamwork, more efficiencies, and our business case has indicated that we will save in the neighborhood of $200 million in terms of expenditures over the next 50 to 75 years that would have otherwise gone to rent and leases in downtown Vancouver, saving money, which in turn can be devoted to community services. We maintain a map of 68 projects that are underway and in the various stages, and that you can very easily see from that the width and breadth of the approach we're taking.
The health investments that are being made in community are a response to requests from community. We know the needs are great, and that these projects are a reflection of where we're active today, and we look forward to advancing many more projects with community in the future.